Also new tonight, two of Ballad Health's flagship hospitals received just 1 star on the Center for Medicare and Medicaid Services quality rating. Johnson City, Bristol Regional Medical Centers joined just 4 other Tennessee hospitals with that lowest rating.
But Ballad leaders say it's a highly flawed system and that those hospitals aren't low quality. News Channel 11's Jeff Keeling talked to a researcher who weighs in on the accuracy of the ratings.
STAR system is a very, very flawed methodology, we feel, because they are not weighing hospitals according to the severity of illness and the social determinants of health. Healthcare equity issues are not addressed on the STAR ratings.
An expert from Washington University who studied hospital rating systems for years says Ballad Health's leaders' criticism of the STAR system has some merit.
Generally, the 1-star hospitals are a combination of hospitals without enough resources and patients without enough resources.
Dr. Karen Joint-Maddox says the system isn't worthless, though.
Like many things, there's a kernel of truth in some of what CMS measures. It's just much more complicated than can possibly be distilled down to one number.
She says the 5-category system only measures data from a select group of Medicare patients, and they tend to be among the poorest.
You have to have patients who can afford their medicines, who show up for their follow-up visits, who don't have barriers to care, who haven't lived with the physiologic effects of structural racism or of intense poverty.
Ballad leaders say they could probably improve STAR ratings at those 2 hospitals by sending sick and complicated patients to smaller and higher-rated hospitals. But they say patients would be worse off in a trade for ratings.
When you look at our tertiary facilities, they have an inordinate number of those complex medical patients, particularly the fee-for-service Medicare patients. And that's by design because that's where we want them and they have better outcomes.
Ballad's Reynolds says some other groups give Johnson City Medical Center and Bristol Regional Medical Center high marks for important types of care.
Multiple entities, including the Joint Commission and Blue Cross Blue Shield, have certified our facilities as high quality for treatment in things like coronary artery disease and heart attack and stroke. To me, that's a much more valuable piece of information when people are making their decisions.
Despite the flaws, Joint-Maddox says she can't blame patients for expressing concerns about STAR ratings.
It is a little bit of a warning. If you're looking for hospitals and your local hospital is 1 star, that would worry me.
CMS STAR ratings are released annually. More on quality ratings and Ballad can be found at WJHL.com.